there are really three things that you need to know about Invisalign. Who your Invisalign provider is critical. Now, there are some orthodontists that still focus mainly on braces that are not Invisalign experts. The reason that an expert is critical is because the entire digital plan is the foundation for how the aligners are made, how they're going to fit, and how the teeth are going to move. And so if you have a plan that is not expert, the teeth maybe will move at the wrong sequence or the wrong velocity. The final position may be off. This leads me to number two, and this is understanding that the aligners need to be worn constantly. And here's a mistake that a lot of people make. They may initially take them out quite often because they're not used to them, and then they mark their progress by merely whether they can put the next aligner on their teeth, knowing they haven't really worn it as much as they should. The aligners need to be worn 22 hours a day. And so there are some patients who wear them mostly at night, but they can manage to advance to the second aligner, the third aligner, thinking they're making progress. This will fail, it will not work. And this touches on the first key foundation of your Invisalign provider, because if the digital plan was not accurate or efficient, the aligners will not feel comfortable. So sometimes the patient starts out wearing them, but their teeth are not following the plan, and then the aligners will start to fit uncomfortably. So even if a patient tries to wear them more, they're just not comfortable. And if the aligners are not comfortable, then of course you're going to be removing them throughout the day. So that's a key factor. And here's the third thing that you need to know about Invisalign. It involves the final result. Invisalign works, and we have incredible results, as do thousands of Invisalign providers around the country. But there is the possibility that you could have a very effective, great result from a functional and cosmetic benefit, and yet you could still have a tooth that seems, to your tongue or even to your eye, slightly imperfect. Teeth are not perfect. They have different thicknesses and heights. They wear differently over time. And so you're not getting a complete set of 24 ceramic veneers like a Hollywood movie star or performer. So you can have a treatment that's successful and still feel like there's a tooth that doesn't look quite perfect. And that is okay, and you need to understand that. Now, if a Invisalign provider gives you just one round of aligners and there's a tooth that's clearly not straight, and then they say, oh, this is as good as we can do, that's not what I'm saying. That's not good. But if you've done several rounds of aligners and you have one stubborn tooth at the end that's just a little bit off, sometimes that can still be a successful treatment that needs to come to an end. And you need to understand that going in.